Hello everyone, my name is Dr. Aditya Gupta. I did my MBBS and MD in Pediatric from AIMS New Delhi. I'm currently pursuing my DM in Pediatric Oncology from AIMS New Delhi. And in this video, I will discuss about a subject that everyone hates, that almost everyone dreads, that almost everyone thinks is too volatile, and that almost everyone thinks is too boring, and that is biochemistry. While almost everyone, or I'll say 90% of the students don't like the subjects or do end up hating it, I totally do not believe in any of these. I feel, and I in fact used to be really good at biochemistry, that biochemistry in fact is a really nice subject. Biochemistry is in fact one of the most interesting subjects, and I'll show you how to make biochemistry interesting. Now, before going into making biochemistry interesting, I'll tell you a little bit about memory. Now, we all know that how memory works. Memory is connected to our senses. All of us remember more when the visual cues are there. That's why you're in fact watching this YouTube video, because it will help you probably remember more. These things are going to stick in your mind more rather than somebody saying this, rather than, let's say, a podcast. And second most important thing for memory more and is the interest. If something is made interesting, it will stick in your memory more. If something is made interesting, you like to read about it more. If something is made interesting, when it's stick in your memory, you'll answer questions about it better, and as a result, your rank will improve. So let's make biochemistry a bit interesting. I'll give you how I made biochemistry interesting for me, and you can use it too. This is mostly a video for second and third year, first and second year MBBS students who might be watching this video. If you're preparing for your NEET entrance examination and you have been doing biochemistry, you can use it as a pick-me-up when you're feeling biochemistry getting a bit boring, it's getting dry, to make it a bit more interesting. So this is where it goes. So like I said, interesting facts are easier to remember. Let's say I said an interesting fact, random interesting fact. The population of UP is more than all countries in the world except three. That is China, US, and Brazil. You'll suddenly remember this. You won't forget about this because it's an interesting fact. Oh, just three countries or something like that. So trivia makes things interesting. Trivia in case of a non-clinical subject is clinics. If you can integrate the non-clinical part of that subject, the paraclinical and preclinical part, to the clinical aspect of it, that thing will become interesting. And that's how I'm going to show as far as this biochemistry is concerned. This has become much more important as far as NEET PG and ISIT is concerned, which we all know that gives more clinical based scenario questions from your basic subjects. And even next has told that there will be 10% questions which will be from preclinical and paraclinical years, but they will be totally clinical context based. So let's begin. So this is from a book which most people don't know about. Case 1, let's say a 15-year-old African American, let's highlight the things. A 15-year-old African American female presents to emergency rooms with complaints of bilateral thigh and hip pain. This pain is present for 1 day and is increasing. This similar episodes of pain episodes have also already occurred. Her hemoglobin is 7.1. Her TLC is elevated, and she's afebrile without any acute distress. Her urinary analysis demonstrated a lot of bacteria. Then they are asking which is the most likely diagnosis. So you have a patient, you have an African American female with a pain episode with a hemoglobin of 7.1. The diagnosis is as clear. It's sickle cell disease. Sickle cell is known for these pain episodes that they are describing. Sickle cell is known to occur more commonly in African American, is given in Robbins. And sickle cell is obviously it causes anemia, sickle cell anemia, and that's why you have a hemoglobin of 7.1. And we also know sickle cell infections are more common, and that's why her TLC is elevated. And that's why her urine analysis is demonstrating a lot of bacteria. And these infections are known to trigger this pain crisis that she's presenting with. So this is a clinical scenario, and this is the clinical scenario how we'll learn about an actual disease like sickle cell anemia. And now sickle cell anemia, the basic pathophysiology is actually given back in your biochemistry in how hemoglobin is made. And hemoglobin, how these cells form, the sickling occurs because there's a patch that occurs on hemoglobin HbS that attaches to another patch, and an deoxygenate forms a chain, and that causes sickling. Now if you knew about this clinical scenario, and if you thought about in this clinical scenario, that remembering that biochemistry fact of sickling, that HPS has a patch, the typical thing that we used to learn about is that the hemoglobin and Harper, there's a diagram, the patch will occur in a deoxygenated state, and that will attach again and again in the deoxygenated state, and that will cause sickling. This thing will be remembered more if you have a clinical scenario. If you have a clinical scenario, this will be more interesting. And this is the case. And this is the clinical correlation. This is a description of pain, that is a sickle cell crisis. Infection is the trigger, which is here. And she's having urine analysis and hemoglobin is low. Again, the same thing. Now, this is this is a small 2-3 pages from a book called Case Files. A lot of people don't know about this book called Case Files. I read it in my first year of MBBS, and I also read it during my PG prep. Not as for PG preparation per se, but whenever a subject used to get boring, I used to pick up a case file, just read a 1 or 2 pages about this case file, and it used to be a very refreshing sort of a thing, especially for the non-clinical and paraclinical subjects, which do get boring without the clinical details. We all love clinics, interacting, that the rush that it gives us, and this case files is sort of stimulates that. And that is the reason I actually was able to secure a gold medal in biochemistry in my college, secure more than I actually secured a distinction in that. So I am just giving you an example of one of the few books that I loved, which is not known by a lot of people, not followed by a lot of people, but actually makes a very bland, a very dreaded subject interesting. Especially the first and the second year, if you're watching this, you can use this for your next preparation. Book this book for a next preparation to make it more interesting. It's not a textbook, by the way. Remember, it's not something from which you can clear your exam. It's just to make your subject more interesting. And for the NEET PG aspirants who are going to give the May NICET or given the April 2019, you can use it again for the similar reason, that to make it a little more interesting. Biochemistry tends to be a very boring subject, and this book is filled with multiple examples like this. This is my own tiny little secret that I'm sharing this today with a lot of people. Thank you.